Hello, welcome back. The topic today is when we diagnose hernia and tell the patient you need to go for undergo a surgery. The first and foremost question they'll ask is whether the hernia will recur. The second very important question they'll ask is which is the best, laparoscopy or open technique. So we all know hernia is nothing but a weakness or a hole in the abdominal cavity through which the organs are coming out. So we have to do surgery. No medicine is useful, so we need to do a surgery. So definitely open surgery, laparoscopy. Nowadays the robotic surgery, the more advanced is robotic surgery has come. Definitely laparoscopy has much more advantage over the open technique. See, but each one has its own good and bad, and they have advantage and disadvantages. Okay, we'll see. Laparoscopy, definitely we don't have to cut. At least if it's a hernia, at least we have to do 10 to 15 centimeters cut. But in laparoscopy, small holes, so no pain. Scar is almost invisible scar, so recovery is very fast. Sickness absenteeism, taking prolonged leave from the work is reduced, so you can join your duty earlier. And medicine, the requirement of painkillers, requirement of antibiotic is very less with the laparoscopy. The number of hospital stay is also reduced. So cost wise, everything is very effective in laparoscopy. In open technique, definitely it has its own advantages. Suppose somebody who cannot tolerate general anesthesia, who are not unfit for general anesthesia, then open surgery is the best, where we can give spinal anesthesia or even under local. Or sometimes people come with complications in an emergency. Suppose that the intestines got twisted on its own and causing obstruction. The vascularity, the blood supply to the intestine is compromised, and the blood, the intestines go for gangrene. Then open technique or the open surgery is the best, or the easiest or the safest way to do the surgery. And people have a huge hernia, we call the scrotal abdomen. Very small hernia is always the good with laparoscopy, but huge hernia is always open technique is the best one. And people obese people, laparoscopy definitely has an advantage. In open technique, obese people, cutting fat, all these things makes that infection rates little higher. People with diabetes, obesity, or immunocompromised, the chance of infection, bleeding is little higher. But in laparoscopy, it is all very less compared to the open technique. And open technique, definitely the surgeon has certain advantages, like they can very closely observe each and every structure without damaging the nearby structures. They can do the hernia repair. So both open technique and laparoscopy and robotic surgery has different indications. And your surgeon is the right person or the best person to decide which surgery is the which technique is, depends upon his experience, depends upon his knowledge. He chooses what is best for you. Thank you.